Let's look at some numbers and see if what is claimed about the side effects and the deaths from the vaccine is true. In fact, one of the things that has been vehiculated online a lot is this graph here from a few months ago, actually, where the reported deaths post-COVID vaccine have totaled close to 5,000 to 6,000. And this was back in the summer, where this graph has been pulled out of data from VAERS, which is the Vaccine Adverse Effect Reporting System. And before we discuss this, I think we need to understand one thing about VAERS. This was set up a number of years ago as a means of reporting side effects from vaccines. However, this is a voluntary, or used to be a voluntary system until the COVID-19 vaccines were put on the market. When that emergency authorization was given by the FDA, healthcare professionals were also mandated, we are under a mandate to report any side effect that is reported by any patient who had the COVID-19 vaccine, whether we as healthcare providers believe or think that is a truly side effect from the vaccine or not. And this wasn't present before this emergency use authorization. This is a new requirement. So you can see, because of this mandate, a lot of the side effects had to increase because there's a whole lot more reporting being done. For one thing, going through that reporting system, it's a several-page online process where you have to enter a lot of detailed information. And in our busy day as providers, we typically don't have a whole lot of time to do a lot of those unless we truly believe that the vaccine has caused somebody a side effect. But like I said, now the game has changed, and we have to do that whether we think that's the case or not. Secondarily, this VAERS system is open not just to healthcare providers, but it's also open to anybody, patients included. So if somebody has a mother or a father who had a heart attack 3 days or the day after a COVID-19 vaccine, as a human, I could understand very well how they feel like there's a connection there because the timing was so close together. And so there is a very good possibility that these people or others that help them go online and report these things. And that's totally fine. I'm not saying this is the wrong thing to do. My whole question here is, can we infer causality from all these reports or not? And in order to answer that question, I wanted to show you something here. We need a few numbers to make sense of that and to answer that question. The first one is, how many people die in the United States every year? And that number is listed here. 870 people for every 100,000 people in the general population in the US die every year. So this is an important number to remember. Moreover, this year about 166 people have been fully vaccinated with the COVID-19 vaccines. So we have this number also to work with. And finally, we know that most of the campaign to vaccinate people here in the US, so far at least, has happened for over the first part of the year for about 3.5 months in the early part of 2020. If we extrapolate this number, 870 per 100,000 people, to the general population in the US, we see that every year we should expect a little bit over 420,000 people dying. This is expected. These are people that die from heart attack, from strokes, from cancer, and everything else that kills people, no matter what else is happening. We are not immortal. People die every day for something. And so this is the number that we would expect to see happen even if there was no COVID around, okay? And if we want to change that number to a daily number, it's about 4,000 people dying per day of any cause. This is the number that I want you to keep in mind. Over 4,000 deaths per day are expected here in the United States, even if we didn't have any COVID going around. And now let's go back and look at some of these numbers. This is also from VAERS. You may have seen this graph circulated around where people say, look, we see a larger number of deaths in the day or two after the vaccine is given, and as the time goes on, less and less of that happens. Does this prove causality? Well, let's look at the numbers. You see here for the first day you have about 600, second day a little bit over 700 deaths per day reported in VAERS after people get vaccinated. And if we compare that with the 4,000 deaths per day that are expected to happen even if we didn't have COVID, you see that this number is greatly below, orders of magnitude below what is expected. I don't see how this is a strong argument to make, to say, you know, the COVID-19 vaccine causes all these people to die. When we only have 700 per day at most, or let's say 800 per day, it's 5 times less than what would be expected even if we didn't have COVID. Now, somebody can come and say, but look, you have this big spike here, you know, and doesn't that fit the scenario where if these things are causally related to COVID vaccination, that's why we see this spike here? Possibly, although again, I would expect to see much more numbers to make a good case for that. But if that were the case, I want to challenge you to think of the second dose. You know, for Pfizer vaccine, the second dose happens around here, and for the Moderna around here. And if this spike early on is caused by of deaths, is caused by administration of the first dose, wouldn't you expect when you give the second dose to see the same or sometimes even worse, you know, because sometimes people react even more vigorously at the second dose? Why don't we see a spike here that would show that indeed we have a problem? You see what I'm saying? So I think it's much more likely in the context of not seeing a second spike with a second dose and seeing 5 times or less numbers of deaths early on, even when people expect that to happen and they are most afraid. I think we can make a much stronger case that this is psychological. These are real deaths. I'm not saying that these are not real events. What I'm saying, my contention here is that these are not deaths caused by the vaccine, but rather temporal associations, and people's minds click and say, look, my dad had a vaccine 2 days ago, and the next day he had a heart attack. There is a connection there. Boom. You can't make such connections. I'm not saying there's nothing there, but in order to make a causal relationship, you have to go in the data and dig deeper and interpret that data appropriately. Otherwise, we are no different than people in Middle Ages that said, you know, the plague comes from bad air or comes from whatever else, you know. We can all make our assumptions, and we're entitled to do so. But if we want to make good sense of data with the tools that science and statistics and surveillance and systems like VAERS provide us, we have to do the work and we have to stay objective. And again, I realize it's very hard when you know somebody, when you had a family member that died shortly after a COVID shot, not to think that that was the cause. I am susceptible too. I'm a human being. When I hear a patient tell that story, I think very hard that that could be the case, and I do everything I can to find out and to report it. But what I'm saying is, when we leave our subjectivity, our little emotional or big emotional, if you want that way, world aside, and we look at the numbers, a different picture emerges. And as rational, intelligent, smart people, like God created us to be, I think it's incumbent on us to transcend our emotional self and also use our rational being and put things into the right perspective. And this is the purpose of this video on my channel, my friend. And to the extent that I helped you to make one step in that direction today, I think my mission is accomplished. Till next time, stay healthy and stay wise.